So, hi to all the viewers. I'm Dr. Karthik Vijayakumar, your endocrinology faculty at DocTutorials. So, I'm here before you, proudly present Dr. Vamsi, who is a proud achiever of All India Rank 6 in the Common Merit List and All India Rank 7 in the AIMS Merit List in the recently conducted INI SS November 2025 session. Hearty congrats to you, Dr. Vamsi.
Thank you, sir.
So, how do you feel now?
A bit relieved, sir. Um,
So,
this was my
see,
second session. Uh,
so the
Last time, I
competition.
think I missed it by, my rank was 24 the last time. So,
So it was a very close fave last time, and this time you had made it. So this
yes,
is a very tough exam. The seats are not that high in number. A lot of students, top students, are fighting for a limited number of seats. That makes the exam all the more challenging. So,
yes,
like before we go deep into the preparation phases and all, like can you just introduce yourself, where you're from, where you have done your UG and PG from?
This is Krishna Vamsi, sir. I've done my undergraduation from Andhra Medical College, Vizag. MD General Medicine from Rangarai Medical College, sir, Kakinada. I completed my MD last February, sir. So I gave my first attempt for both NEET and INI SS Endocrinology. I couldn't crack NEET that time. So this is the second attempt, sir.
Okay. So fine. So you have all around 10 months since you have passed out from the MD medicine. So when did you actually like this actually really decide that endocrinology is going to be the specialty that you are going to work upon? Did you make that choice in the final year of your residency itself, or after you had passed out?
No, sir. At final year of my residency, I was thinking of two or three departments, sir, to go to. Uh, it was definitely after the exam, sir. Like endocrinology was always in my option, sir. But I mean, like it, only when I was preparing for INA, I made it sure that I'd be going for endo, sir.
So when you had like made up your mind for preparing for endocrinology, you had one more hurdle ahead of you, that is the MD finals and all. So how did you balance your preparation? Did you like really had a devoted time preparing for endocrinology that time, or the dedicated preparation came only after your MD exams were over?
MD exams, all the time was only about MD exams and for the general medicine papers, so that is NEET paper. Specifically for endocrinology, I did started my preparation after I did clear my exams, sir.
So there would be so many students like who have like passed out 6 months, 10 months prior to their INA exam, and I think yours would be a good roadmap for them to follow or take inspiration upon. So can you just take me through the journey? Like once you had like started dedicated preparation for endocrinology, how did you face your preparation? Like what are resources that you have used, and how did you progress throughout the preparation in endocrinology?
Uh, My first attempt, sir, specifically for IND endocrinology, it was only the gap between the NEET and the INA sessions. That was only 1 month. That was my only preparation, sir, for 30 days. 10 days for covering up all your main videos, sir. Uh, and the next 20 days, the first 10 days for two revisions, and the last 10 days for three or four grand tests from DocTutorials. And then I gave the exam, sir. So I even didn't go through, I mean, I didn't have time to go through the Q bank also, sir. Then Mm, that was my first attempt, sir. Then I felt that I did a bit better with that amount of preparation because I used to hear that we need to go through Williams and all at least for once, at least for Williams tables, but I couldn't get that time. But once my first session is done, then I clearly got I almost like I planned for 3 or 4 months, sir. Then I went through all the main videos. Then I got through what made the difference, sir, was actually not the main videos, yes, sir, definitely, but I've gone through all the revision videos and the interview sessions also, sir, even for the exam. So I used to add all those points even in the main videos itself, sir, so that it gave me a feeling like I covered up everything. Then I thought of starting Williams, but I couldn't do it actually. I went only to the tables, sir. Even those tables I added upon it to your main videos notes. And for 1 month, I've done. For the second time, I've done completed all the Q banks, sir,
So you
for this
feel
session.
like you had experience of attending two INI sessions, and I should like commend you to the fact that even though you had just a month for like prior to the appearing for the first INI, you still was able to get an All India rank of 24, which is like really an exemplary achievement from the very first attempt itself. And definitely you have moved your way up to rank number 7. And do you feel like whatever the resources that we offer at DocTutorials, be it the long videos, the QRP videos, the QBank, of course, I would agree that you may have to go through certain important charts and diagrams from the Williams. So, but do you feel are the resources as a standalone material will be enough for any student who is aspiring to attend the endocrinology INI?
Uh, yes, sir. I think last session, May session, sir. mm, uh, I am a clear example, sir. Only main videos, and I got the rank of some 24, sir. That was only the main videos, not even the Q bank. For the second time, sir, I think the second time, I mean, the recent paper was bit more of clinical or a bit lengthy paper. Many people said that I mean, at the same time, there is nothing, no question that came out of the syllabus, sir. I think main videos should be the standalone, sir. Apart from that, if okay, adding Williams tables is also good, but what I felt was even covering the interview session videos for the theory exam is also important, sir, because few points like some statements and few lines. I think for the first exam, I still remember during the summer session that 10% difference of plasma glucose levels.
Correct.
I think that was covered in the interview session, sir. I got that point from the interview session. The next revision sessions, I think you again repeated the statements, sir. So on a whole, all the videos are important. To have the touch, maybe going to the interview videos and revision sessions is also important, sir.
So I think this is one point that none of the previous rankers have mentioned. Like those they would be reserving the interview preparation videos just before the departmental assessment. As I told you in the interview sessions, because now we have around 6 to 7 sessions which is already uploaded in the app, and in each session we will be trying to have an overview of the entire subject in say 2.5 hours. So again, if you have time, it will be worthwhile
Yes,
going
sir.
through that 10 hours, 12, 15 hours. It will be a good revision for you. You will be able to brush up the points. And as Dr. Vamshi has rightly pointed, you make it a few points which would be exam worthy also. Now, another challenge that the students often face, and I want to know from you, what was your strategy like? How to balance the MCQ solving along with the watching and revising the the long videos and the notes.
Uh, MCQ, sir. Maybe I think it depends upon the paper, sir. Last time in the May session, they were straight forward questions, sir. Um, I think the Q bank covered almost all the questions, sir. Maybe like uh, I think even the GT questions, I think they resembled more with the paper, sir. I think doing Q bank definitely gave me what for the second session, sir. Actually,
So I think the bottom line would be like you cannot expect what sort of a paper you are going to like have the next time around, because in the last 5 sessions I think three of them were more of a one-liner, very short questions, and the other two were more of a clinically oriented session with long questions, many of the true false statements like that. So I think as an aspirant, as a serious aspirant who is aspiring to get a digit rank in the I think you should be prepared for all formats. And
yes, sir.
as Dr. Vamshi has put it, long videos again should be the key, should form the backbone of your preparation. And to supplement it, I think a good MCQ revision practice should go a long way in help you secure a great rank. So, like comparing to the you have already mentioned that the current exam was difficult compared to the April session. So, like any adjustments that you had made within the exam hall that help you successfully complete the exam, like the time allotment, because again that is one area of concern for the students, and where you able to go through the entire set of students, so entire set of questions once again during the exam. So, how was it like on seeing those slightly tougher questions?
Uh, Questions wise, it was okay, sir. I mean, like there was not even a single question that came out of the syllabus. So we know I mean, what made it difficult was the statements, sir. Actually, like two close statements took away all the time, sir. Maybe this exam, the difficulty was not maybe endocrinology. It was a lengthy paper. What got affected was the general medicine paper, sir. By the time almost, I think I was left with only 10 minutes for 25 questions. So time management, as you said, is important, sir. I think I've stuck with three or four long MCQ questions. I think you said that once that maybe going with the last statement reading first or going with the options first might help, sir. But
Yeah,
in the exam
absolutely.
tension, I might have we might not have done that. Uh,
Sure, that is one very important thing, because you may spend the time which is actually should be divided for around 2 to 3 questions for just a single one, and thereby you may have to rush for the remaining questions, and there is a high chance that you make some silly mistakes which can actually drastically bring down the rank. So very important point, Dr. Vamshi, is the time management, especially in a lengthy paper. And those students who are moving forward to attend the next session as well, so please keep that in mind regarding the time management. You should divide the questions into certain blocks and make sure that each block is being finished in the appropriate amount of time. So, Dr. Vamshi, the first theory paper was only the first half of the entire like AIMS exam. You still had to go for the departmental assessment. So, how did DocTutorials as a platform help you? You had already mentioned about the interview session, and how was the interview like? Like, were you able to answer the questions? Where was it tough ones, clinically oriented ones, or just the factual Viva type questions which you got?
uh, Actually, it was mixed, sir. Uh, I mean, like for me, I think this time I faced with only five actual questions, straightforward five actual questions: side effects, mechanism of action, some natural cause of diabetic amyotrophy, these type of questions. But last time, definitely it was more clinical, sir, approach and how do you manage a case like that. I think both the approaches are important, sir. I mean, once again, brushing up all the endocrinology is important because they even asked me precisely regarding the pediatric side effects of thyroxine, raised intracranial pressure. How does it, I mean, patient presenting as a lateral rectus palsy. So precisely they asked me about the pediatric complications. They precisely asked me about the natural cause. I think brushing up all the endocrinology subject once is important, and definitely, I think there were few sessions of yours regarding the clinical approach and few case-based scenarios. That also helped me last time, sir. Actually, I think we have to be prepared for both the questionnaires sets, sir.
Exactly. For even before the interview, you may have to read your theory notes prepared from the long videos, right? So that is what the
Yes, sir.
feedback that I get from most of the students. So now the difficult part is almost over. You have a excellent rank in your disposal, like even before the NEET SS is around the corner. So how is your like preparation and mindset going into the NEET paper?
Uh, a bit relaxed, sir. Uh, I even took a break for these 2 days. I should again start giving GTs from tomorrow. But mostly, I think I'm clear that I'm going to join from this rank, sir, from INI.
Okay, so good for you, Dr. Vamshi. So, if you want to give out one piece of advice to the upcoming students who are going to attend the further INIs, what would that be?
Yes, sir. I mean, like getting into like a single digit rank is a bit tough, sir. Actually, I mean, even last time it was a just it was one MCQ said that made difference of 8 ranks. I think for that one MCQ, I think all the long videos, all revision videos, all even interview session videos, And even that I have to mention about the WhatsApp group, sir. I think those compilations of few topics, sir. Even I added those to the long videos. I think this four should be must, sir, not to miss any MCQ from the exam.
Very important because each question matters. As you told, it can bring your rank up or down in a drastic manner, so that you may even gain or miss a seat in the margin of few decimal places. So once again, we are very happy and proud to have Dr. Vamshi with us, and big congratulations once again from the entire DocTutorials team, and all the very best, Dr. Vamshi, from myself and from the entire DocTutorials team.
Thank you,
Thank
sir.
you.
Thank you so much, sir.